Good morning, afternoon, and evening, everyone. Thank you so much for joining us on the second day of the conference, Disability, Social Protection, Inclusion, Dialogue for Change. For those of you who've already joined us yesterday, you've been able to follow really interesting discussions around measuring extra cost for disability, as well as a session on cash transfers or covering healthcare costs. Today we start the day with three parallel sessions, looking at the needs of people with disability along the life cycle. This is the working age session. We also have a session on children and old age in parallel with this one. Unfortunately, we have spoken language interpretation only for the child session. So in case we have anyone who joined here needing spoken language interpretation, unfortunately, it's only the child session where we can offer this. But we do have closed captioning and we have sign language interpretation in this session. So welcome once again. I invite you to introduce yourself or ask any technical questions that you may have in the question and answer in the chat box of the Zoom function. Throughout the session, if you want to ask any technical questions to any of the speakers or to myself, don't hesitate to use the question and answer function. So we would like to have the content discussion captured in the question and answer function, and then any other communication, also technical difficulties, please use the chat for this. And with that, I would like to turn to introducing our speakers for today. So could we please move to the next slide? We will first hear from a representative of an organization for people with disabilities and their key asks regarding a social protection system support for people with disability in working age. And this will be done by Peter OChieng from the University of Leeds. I will not go into the details of the biographies of all of our distinguished speakers, but we do have the slides, and information is also available on the conference website. So after Peter, we will have Phatcharamonth Pitipanyakul, who is the director of the Division of Rights and Welfare of Persons with Disabilities at the Ministry of Social Development and Human Security in Thailand. Followed by Rafael Guerreiro Osório, a researcher and coordinator at Ipea, IPC-IG. And he will talk about the experience in Brazil. Then we will have a presentation on the Cash for Work program supported by the German International Cooperation Agency, Ismail Mustafa Ismail, and this is the Cash for Work program in Iraq that he's going to talk about. And then finally, we'll have interventions from our social partners. We'll have Damaris Mojica from Kenya, and for the workers' representatives, and we have Matthias Torns, Deputy Secretary General of the International Organization of Employers. Thanks a lot. And with this, we will go to our first speakers. Just to contextualize a little bit further. So yesterday at the conference, we focused a lot on cash transfers and measuring costs. Of course, cash is not everything. The presentation from Brazil will talk about how cash can facilitate or not the inclusion of people with disability in the labor market. But in addition to cash, there's also a lot of other things needed to empower people with disability, to facilitate independent living, to facilitate their social and economic inclusion. And of course, for working age population, the key question is for working age population with disabilities, that they face a lot of barriers to enter the labor market. And what can social protection systems do to facilitate their access to employment, to entrepreneurship, to active labor market programs, and how can they be made inclusive? So Peter, what are the key asks from organizations of persons with disabilities in this regard? The floor is yours.
Okay. Thank you very much, Veronika, for your kind introduction and remarks. And I'm here to represent organizations of persons with disabilities, and I'm going to just highlight the key asks. Okay, so persons with disabilities face significant barriers, discrimination, stigma, and lack of support that eliminate their opportunities to enter the labor market. In fact, figures show that there's a significant inequality gap between persons with disabilities and persons without disabilities in regard to employment. Most working adults with disabilities need some form of social protection to guarantee their basic income security as well as meet their disability-related costs. Most formal contributory social protection programs often focus on a few percentage of persons with disabilities because they primarily target those employed in the formal sector. Yet, majority of persons with disabilities work either in the informal sector or do not have any employment at all. Most persons with disabilities need support to enter the labor market, as persons with disabilities have to pay for the disability-related costs to seek work. For example, they have to pay for accessible taxi, they have to pay for personal assistants, sign language interpreters, among others. Similarly, even if they get a job, they have to pay for this disability-related cost to remain in the labor market, and this often maximizes their spendings. So, persons with disabilities should be eligible to benefit from the available mainstream schemes for working adult aid, such as unemployment benefits, maternity benefits, among others. However, they should also be targeted by specific schemes that cater for disability-related costs, as well as benefiting from other labor market policies that increase the employability of persons with disabilities. Social protection systems, both mainstream and disability specific, can play a crucial role in establishing a foundation for many working age adults with disabilities to enter or remain in the labor market. These systems can greatly increase the engagement of people with disabilities in the labor market and in society at large by ensuring that they have income security, that their disability-related needs and extra costs are covered, and that they have effective access to all services they may need. So, thank you. That's the key as from persons with disabilities. Back to you,
Excellent.
Veronika.
Thank you so much, Peter. This was really great for setting the scene, and thanks for reminding us also of the challenges, not just to access the labor market, but in particular also to access formal employment, as people with disabilities are also overrepresented in the informal economy. And of course, access to social insurance has important implications also for other life cycle risks, as you rightly mentioned, including the risk of unemployment, maternity benefits, etc. And also we heard your strong call for ensuring that both mainstream schemes are accessible for people with disability, as well as the importance of designing disability-specific schemes that will help people with disability to access the labor market. And thirdly, a strong reminder that there is also a cost for people with disability to enter the labor market. And this cost is higher because of additional costs they may face and for extra transportation, for interpretation, for personal assistance, etc. So for people with disability, these extra disability costs for taking up employment also need to be taken into account. And with this, I would like to hand the floor to Phatcharamonth Pitipanyakul, and apologies for if I'm not pronouncing your name correctly, who is joining us from Thailand. Thanks a lot for being with us and sharing the experience in Thailand of designing a personal assistance support scheme.
Many thanks, Veronika. My name is Phatcharamonth Pitipanyakul from Thailand. First of all, I thank you very much for the invitation to share our experience and the evolution of the personal assistance scheme in Thailand. Today, I will talk about 3 aspects of the PA service in Thailand: the service, the gaps and challenges, and the future direction. Next slide. The Disability Rehabilitation Act was the first disability law in Thailand, effective from 1991 to 2007. It has now been replaced with the Person with Disabilities Empowerment Act 2007 and its amendments 2013. The Act has a provision on personal assistance service in Section 20. And we also have regulations on the provision of PA service. To give more details and how to the PA service should be provided. According to the Act, PAs are a person who assists individuals with disabilities to perform daily activities and participate in the social activities. Now, persons with disabilities can have the PA service for up to 6 hours per day, or the 180 hours per month based on their needs and their PA service plan. The government pays for the PA service, which is a 50 baht or the 1.5 USD per hours. Although the payment is quite low, the service gives the independence to more and more persons with disabilities, increasing their self-esteem and determination, helping them live in their own communities with dignity to empower persons with disabilities. Next slide. Now we have a PA training curriculum, 54 hours divided into 2 parts. The first part is the theory part, 24 hours of the training, and the second part is the practice part, 30 hours. Once trained and certified as a PA, the person can register to become on a PA at the Bangkok Disability Service Center or the nearest provincial Social Development and Human Security Office or the PSDHS office. For persons with disabilities who need the PA service, they must have a disability card, which means they need to register as the person with disability first. And second, they need assistance for the daily activities. Now we have a 1,261 personal assistant throughout the country and 6,305 for persons with disability have used the PA service. In the past 3 years, the main budget comes from the fund of the empowerment of persons with disabilities, which is 26.89 million USD, or the 95.5%. And the government allocate only 1.28 million USD, or the 4.5% for the PA service. We also have a community volunteer personal assistant, or CVPA. In 2020, there were 32 hospitals that trained their personnel to become a PAs. The pilot project could train 154 trainees. By the way, the 32 hospitals have registered themselves as the disability service centers. Another system that enables any local service delivery organization to provide service to persons with disabilities. This year, we have trained 2,457 for the new CVPAs from the 51 hospitals and 71 for the PSDHS office. Due to the COVID-19, we had to provide the online training and only the theory part. Once the restrictions are lifted, we will train them on the practice part physically. For next slide, we have three major areas of the gaps and challenges, which are the one is the resources, and two is administration, and three is the clients. Since our budget is quite limited, it's difficult to expand the PA service. In terms of the administration, we lack a clarity of the PA responsibilities. The reporting is still on the paper, which made it hard to keep track. We have low incentives for the PAs, and we don't have a continuous professional support for them. As the clients, we don't have enough PAs for the person with disabilities that need them. And now we have over 2.1 million for the person with disabilities registered, or the 3% of the population in Thailand. Most of them don't have access to the PA service also. Next slide. We now in the process of amending and our regulations on the PA service to improve the effectiveness, efficiency, and coverage. We have 6 objectives. First, we need to comply with the new government division law. Second, we need to improve our clarity on PA qualifications and training curriculum. Third, we want to increase the number of PAs and the service coverage. Fourth, we want to provide better incentive of the PAs. Fifth, we want to improve PA professional support. And the last, we also want to have our code of conduct for PAs. The next slide. In terms of the service delivery, we want to have a long-term PA master plan. The goal is to improve the admin of the PA service delivery and make sure it meets the current of the future needs of persons with disabilities. There are several ways we want to improve. First, we want to use more the digital technologies to improve the PA service delivery. And we want to standardize the PA service, which have already started. And we want to have needs assessments to make sure the person with disabilities receive enough service based on their needs. And we want to raise awareness on the value of PA to encourage more people to become a PAs. And we also want to involve local organizations and stakeholders in the development of the PA service too. Okay, that's why this is the end of the presentation, and thank you for your attention. Over to your Veronika, please.
Thank you so much, Phatcharamonth, for this excellent presentation. It's really, really great to see how you're really introducing a scheme anchored in law that is so well thought through, starting from the identification of possible personal assistance, their training, your constant strive to improve the scheme to meet better the needs of people with disabilities and to make sure that they can live with dignity in their communities. And yeah, congratulations to all that you've already achieved, and good luck. I mean, thanks also for acknowledging that there are still challenges and illustrating also how you're now working on addressing these as well. This is really, really interesting, and thanks for sharing with us. So with this, I would like to quickly turn to our next speaker, Rafael Osório, who's going to share with us the experience in Brazil.
All right. Good morning, good afternoon, good night, whatever applies. I'll be talking today about the Auxílio Inclusão. The inclusion aid is a new benefit in Brazil to incentivize the participation in labor market of persons with disabilities. Next slide, please. Okay, so just to give you some background, in Brazil, we have a non-contributory means-tested old age and disability pension called the Benefício de Prestação Continuada, BPC. And thanks to this pension, poor persons with disabilities, they receive one minimum wage per month. So since it was created until 2011, the concept of disability implied that the person should have some permanent impairment, so the person should be unable to work. And at that time, the BPC would be canceled if the person with disability would start informal employment. So it was incompatible. Working and receiving the pension, it was not possible. So persons with disabilities that were receiving the pension could only have informal employment, not formal employment. In 2011, there was a change in the concept of disability. So persons with disabilities that would cause a temporary impairment that would make them unable to work for 2 or more years started to get the BPC. They could get the pension. And there was a change in the rules so that people could have their BPC suspended if they started formal employment, and later when the occupation, the activity, the labor activity ceased, they could resume the BPC. After the contract was terminated or after the end of the unemployment insurance, because some of the workers might work for long enough to be eligible to an unemployment insurance. And the other thing is that if this suspension resume cycle occurred within the 2 years of the disability assessment and the income assessment, the means test, there would be no need for a new assessment to resume the benefit. And another thing that was another measure that was taken then back in 2011 was to provide some job search assistance for persons with disabilities. So we have the system, the unified system for social assistance in Brazil. It's called the SUAS. And opportunities for people with disability would be advertised by the SUAS system, so that theoretically people with disabilities would know about the job opportunities in their area. Next slide, please. So in 2015, the Lei Brasileira de Inclusão, which is the Brazilian Persons with Disabilities Act, is a law that unified all the legislation for persons with disabilities in Brazil. So this law created a monetary incentive for labor market inclusion of the beneficiaries of the BPC with disabilities. And that was on top of that suspend resume guarantee. So the idea is that it's not enough to guarantee that the person can resume the benefit after the work experience, but also that there should be a monetary incentive, because for some persons with disabilities, if you get a minimum wage job, you end up receiving less than the pension, because then the contributions for Social Security would be discounted. There is the issue of commuting to work and another cost associating with starting to work in a formal employment. So only 2021, the Auxílio Inclusão was really implemented, and its value was set by the Lei Brasileira de Inclusão as 50% of the BPC, which is now about $120 every month. And another very interesting thing is that the Auxílio Inclusão, the benefits and the salary or the earnings, because the person can work as self-employed if the person contributes to the contributory system. The benefit and the salary earnings of this person that is working will not count as household income for other BPC beneficiaries in the household. So if you start working and you have another person with disability household, the extra income that you're getting from work will not render the other person not eligible for the BPC by the means testing, the income means testing. So what does it take for you to be eligible for the Auxílio Inclusão? You must be a person with disability that is beneficiary of the disability pension. You can be an active beneficiary. You could be receiving the pension right now, or you could be working and have had your BPC suspended up to 5 years ago before the start of this work, because some people were already working with their BPC suspended. So these people are also eligible for the inclusion aid. So, however, if the BPC was suspended for a long time, this person will have to go through new assessments in order to receive the inclusion aid. It's not compatible with receiving other pensions. If you're receiving unemployment insurance, you have to wait for the end of the unemployment insurance before you apply for the inclusion aid. It's only formal occupations, that is occupations that generate contributions to Social Security. And there's the salary or earnings cap. The activity that this person is doing cannot, the salary or earnings can be just up to 2 minimum wages. If it's more than that, the person will not be eligible for the inclusion aid anymore. And also the person should have moderate or severe disability. But this is to be determined by an ICF-based assessment that has not been implemented yet. So until this assessment is implemented, it's taken for granted that everyone that applies to the inclusion aid and is a person with disability beneficiary of the BPC would fit in the moderate or severe disability while this assessment is not implemented. Next slide, please. So how to claim the Auxílio Inclusão? So in my view, the Brazilian government already has the capacity of granting the Auxílio Inclusão automatically. That is, when someone enters formal employment, you verify that the person is beneficiary of the BPC. It's all integrated. There is interoperability between those systems, and you could be granted the Auxílio Inclusão automatically. But right now, it's not like that. You have to claim the activation of the Auxílio Inclusão, and this can be done through two different channels. You can go in person at an INSS branch. INSS is the agency that operates the Social Security benefits and some social assistance benefits in Brazil. Or you can go to the CRAS. CRAS is the social unit, the basic social unit of the Unified Social Assistance Systems. There is one CRAS in each municipality of Brazil. INSS branches are not present in all the municipalities, but you can go to one of those two places to claim the Auxílio Inclusão, or you can use the smartphone app. And in the smartphone app, it's called the Meu INSS or My INSS. There is an option for you to claim the Auxílio Inclusão. So you can do it using your smartphone. So when the Auxílio Inclusão is granted, BPC is automatically suspended. And this is interesting. The AI is a different benefit. It's not the BPC. Its value is 50% of the BPC, but it's a different benefit. It has a different budget. The BPC is a social right guaranteed by the Brazilian Constitution, so people can claim the BPC in courts, but the Auxílio Inclusão, it's not. It depends on budget availability. So upon termination of labor activity or the unemployment insurance, if the person is eligible for that, the AI beneficiary should claim the deactivation of the Auxílio Inclusão in order to resume receiving the BPC. The BPC can also be resumed for people that are receiving the Auxílio Inclusão in some special cases. those that unpaid leave or labor contract suspension. If the labor contract is suspended without remuneration, the person can ask for the BPC to be resumed. And while receiving the AI, the BPC is suspended, but the periodical assessment that has to be done, the means test and the disability assessment, they continue as mandated by the BPC rules. So the person is still participating in the BPC, only the benefit is suspended. Next slide, please.
Yes, you need to wrap up also.
Okay, implementation.
Thanks.
This will be very quick. So only in October last year, 2021, the standard operational procedures for the AI were issued, and only 22 people were granted with the AI so far, 20 in December, 2 in January. We still don't have the numbers for February. So the AI is almost a secret benefit. Few people know about it, and it was launched without a communication campaign. It's very hard to estimate the potential number of beneficiaries for this program among the more than 2.5 million persons with disabilities that receive the BPC today. In the 2022 budget, Brazilian budget, we have around $38 million allocated for this benefit. And this corresponds roughly to 43,000 benefits. That's the government estimate. But I would say that given the current take-up rate and lack of advertisement and awareness about the benefit, it can be assumed that this number will stay below the government estimate unless something changes and people start to be aware of the possibility of claiming this benefit. So thank you so much. It was very nice to be here with you today. Over to you.
Thanks a lot, Rafael. Again, a really interesting example of, I mean, first of all, showing that there is a strong need to make benefits for people with disability compatible with work. And this is something that a lot of countries around the world are struggling with. I mean, a lot of the legacy systems that have been in place for a long time, they were framed around considering disability as meaning incapacity to work and a disability benefit meaning income replacement. And of course, with the adoption of the Convention of the Rights of People with Disability, there was a whole paradigm shift on how we understand disability and a much more push for inclusion, economic and social inclusion, and really considering more the barriers that people with disabilities face to become active in the labor market. And this incapacity to work requirement locks them into inactivity, of course. And it's great to see that in Brazil, at least, there are efforts being made to provide incentives for people to participate in the labor market, to take steps that they don't lose their benefit if they decide to enter the labor market and work. Even if there are still difficulties with the implementation, with the take-up. I mean, I understand it's a new scheme that's just being rolled out, but it's definitely heading us towards the right direction of trying to ensure compatibility of disability benefits when entering the labor market. And with this, I would like to turn to our next speaker, Ismail, sharing with us experiences on the Cash for Work program in Europe.
Thank you. Please be so kind to go to the next slide. Again, next. Thank you very much. Good afternoon from the Hogan Kurdistan region of Iraq. My name is Ismail Musaf, and I am grateful for the invitation to this conference on this important topic. I want to share with you today some insights from the GIZ P4E program that is commissioned by the German Federal Ministry of Economic Cooperation and Development. Especially, I would like to talk with you about Cash for Work and how we implement inclusive activities with a focus on persons with disabilities. Then put a spotlight on one of our activities that is an implementation example and conclude with some of our lessons learned and maybe also recommendations. Next slide, please. Okay, thank you. Cash for work interventions create short-term employment and income opportunities that can temporarily stabilize households' incomes following a disaster or crisis. Cash for work activities are essentially social protection programs through providing the opportunities for basic income security that also contributes to temporarily finance independence for the most vulnerable and crisis-affected communities, and it is regarded as means of bolstering social safety nets. The GIZP4E program directly implements activities in the fragile context of the Kurdistan region of Iraq and Nainawa in the federal Iraq. The activities differ widely in range and implementation in numerous sectors like agriculture, environment, health, digitalization, and others. Next, please. Thank you. We target IDPs, refugees, returnees, and the host community. However, we have a special focus on the inclusion of persons with disabilities, women, and youth. Since the beginning of Cash for Work activities, we also have a focus on activities within camps and the support of camps as a form of crisis or shock response. In the governorate of Duhok itself, there are more than 20 camps for IDPs, mostly Yazidi from Shingal, and refugees mostly from Syria. Persons of mentioned target groups are selected based on various criteria vulnerability. These vulnerability assessments are coordinated and agreed upon with stakeholders that operate in the country, like social affairs, governmental directorates. The registration for activities is tried to be conducted as accessible and transparent as possible. For this reason, we created our own registration process through online forms that can be accessed through links that are shared on social media platforms. We also have a feedback hotline that illiterate people can reach out to. In the last 6 years, persons with disabilities has been included in hundreds of Cash for Work projects, some of which were specially designed for persons with disabilities. One of these projects I chose to describe in more details. It was a project that was specially created for persons with disability and relevant institutions through carpentry works and gardening activities. Next slide, please. Thank you. This project results can be summarized as follows. Various furniture like chairs and tables have been produced and about 2,000 square meters of green spaces have been rehabilitated. The involved persons gained basic income security through, as well as proof of working experience that is valuable for the labor market, especially considering that many of them never received a chance to show off their skills, especially women. Gaining skills and income helps to increase the self-confidence of beneficiaries and dismantle the existing stigma of being unproductive. Say that the challenge that we see and also experience include the poor and inadequate education and vocational training system. Furthermore, social stigma and a lack of acceptance in the society is very high, as well as institutionalized discrimination. Next slide, please. Thank you very much. Since 2017, more than 34,000 people have been placed in short-term employment through cash flow measures that have been directly implemented by us, including more than 2,500 persons with disabilities. This year, again, we are aiming to include an additional 400 persons with disabilities through our projects. Our online lesson and also recommendations would be that access to work plays an integral role in improving the well-being and inclusion of persons with disabilities, and with that any sort of active labor market measures. Promoting the inclusion of persons with disabilities according to the Convention of the Rights of Persons with Disabilities is making a huge difference for the entire society. Opportunities to work help persons with disabilities increase social relations and networks, and decrease their social and economic dependency. Thus also prevent exploitative relations with families and employers. What is also important that a certain percentage of the budget is allocated for the inclusion efforts of persons with disabilities in the operational planning of activities. Next slide, please. With this, I would like to conclude my presentation and thank you for your interest. Thank you.
Thank you so much, Ismail, for this again, fascinating presentation. And I particularly liked how you showed the interconnection between economic and social aspects when public works programs make the effort to include people with disability, whereby it's not a question of stabilizing income or providing income security. It also really triggers or boosts self-confidence and self-esteem. And it also, for people with disability, helps them to broaden their networks, to also create new social contacts, and also increasing their visibility in society, which can also help to fight stigma and discrimination. So this is a really interesting experience that you've shown. And I agree that also, I mean, for public works programs in particular, they need to lead by example, since this is really a public investment in labor markets. It needs to lead by example in terms of including people with disability and empowering them. And all of this in a shock responsive or like post-crisis context, if you want. This gives, I think this is really good, that we see that this is possible in any context in a way, and this is also a really interesting aspect of the work I find that you're doing. And for the concluding element of this session, I would like to invite social partners to make some observations also on needs and support for people with disability in working age. And may I first please ask our representative from the workers, Damaris Mujica, to come in.
Hello, everyone, and good afternoon from Nairobi. So my name is Damaris Mujica, and it's a pleasure to share my sentiments from a workers' perspective. Next slide, please. From a workers' perspective, social protection is a fundamental right. It's not a privilege, It's not a political pronouncement. And secondly, trade unions and workers do appreciate the life cycle approach to social protection, that it directly impacts the working population. Any social protection benefit that is granted to any person within the life cycle directly impacts the working person. And this is more prominent, especially in sub-Saharan African countries, age dependency. For instance, we have an average of 76% age dependency rate in some majority of sub-Saharan countries. And therefore, shocks such as the COVID-19 pandemic have been revealed to affect persons with disability and workers living with disability disproportionately. And therefore, it's very important that it's good to have a universal protection, but our opinion is that we need to go beyond universal social protection and consider the unique costs that are incurred by workers with a disability. Next slide, please. These are our concerns as workers' representatives. And at the national level, we are concerned by the low coverage of social protection, and especially workers who are living in the who are working in the informal economy. And we call it a double tragedy if one has a disability and is working in the informal economy. This is because generally workers who are in the informal economy have very minimal social protection coverage. They have, for instance, they have no work injury benefits, they have no maternity benefit or even sickness benefit. Our second concern is the low investment in social protection schemes and system from government. So you'll find generally in Africa, we have less than 5% of investment or expenditure of our GDP that goes to social protection systems, against a 12.9% global average expenditure. The third of our concern is the targeted nature of our existing social protection programs. We are concerned because most of our African countries, and especially in sub-Saharan Africa, the existing social protection programs targeting persons with disability only caters for those that have severe disability, and leaving out and not considering other social economic factors, such as the extra costs that are incurred by workers who are living with a disability. And the second concern that we have about the targeted approach is because majority of our countries have no efficient labor market information system that can aid targeting or even delivery of such benefits. Our fourth concern is that we have observed weak coordination mechanisms of existing social protection programs. And this leads to duplication. It leads to double dipping, because you'll find a multiplicity of government agencies, community-based, county-based agencies that have almost similar social protection programs. And this leads to inefficiencies. And at the enterprise level or the workplace level, we still observe great discrimination of workers who are living with a disability. For instance, there's no equal employment opportunities. So you'll find countries have put in place national policies. For instance, you'll find a national policy that has set a 5% quota that should allow recruitment of workers with disability. But though we have such policies, their enforcement is very, very low. And our last of our concern is the exclusive nature of workplace policies and practices. For instance, we have observed that very few employers and workplaces have provided for assistive devices to workers who are living with disability. So they are left to provide for from their minimal incomes. Next, please. So these are our recommendations on how we can guarantee a disability inclusive social protection to cover or provide benefits and cushion our workers who are living with a disability. And number one, we need to lobby for increase of investments in social protection system. And the only effective way is to have countries and governments commit through national economic plans, where we are deliberate and intentional, and even identifying particular needs, for instance, unique needs of workers who are living with disability, and set aside a definite percentage of investment for their social protection. And secondly, we need to progressively shift from the targeted approach, get to universal, yes, but it's not enough to have a universal coverage. We need to have a disability specific benefits for workers who are living with disability to cater for the extra costs that facilitates their working. And thirdly, we need to strengthen coordination, because as I have mentioned, lack of or weak coordination results into inefficiencies. And coordination, effective coordination, can only happen when there is social dialogue and tripartism. And for instance, in Kenya, it has been proven that whenever you bring social partners on board and include them in the governance structures of social protection schemes, there is improved governance, yes, and we are also able to enhance inclusion of marginalized groups, but in this case, persons living with disability at the workplace. And lastly, it's very important that we, through collective bargaining, we can support reasonable accommodation at the workplace. And this means social dialogue right to the enterprise level. Thank you so much.
Thanks a lot, Damaris, for this excellent overview of all the things that need to be addressed when designing social protection systems to really make them work for people with disability and working age, starting from underinvestment in social protection in general, to also disability-specific schemes. They're targeting, they're focused on only severe disabilities, whereas it's clear that also people with moderate disabilities have support needs and can become much more productive if they receive what they need. To also data issues around labor market information systems, but also data in general. The lack of coordination and fragmentation that is often a big issue to ensure support is efficient but also meet needs. To finally, questions around assistive devices and reasonable accommodation. And of course, all of this can be done much better if there are participatory mechanisms, social dialogue, and the involvement of organizations of people with disability. We are slightly running out of time. But I'm really happy to have with us also Matthias Thorns, who will give us some inputs from the employer's perspectives. Thanks a lot, Matthias.
Thank you so much, Veronika, and thank you so much for having me at this important panel, because it's of crucial importance to make sure that people with disability have chances to enter the labor market. And we have heard before from Ismail, but also from you, Veronika, how important it is not only for the economic well-being, but also for the social well-being. Social protection system can play an important role in this regard, and I would like to focus on three main work streams in this regard. First of all, medical rehabilitation, where through social protection, the core issues with regard to the disability can be addressed, where we can make sure that any kind of illnesses, chronic challenges can be directly addressed. The second point is occupational rehabilitation. And this is what we have heard before already in many of these examples, right? That is about giving special assistance to job seeking, having particular courses for vocational preparation, for vocational training, having special vocational training itself, providing subsidies to employers so they can make the adjustment to employ a person with disability. Give financial support to create actually employment situations. That's what was the example actually what we have heard from Iraq, right? Where employment was created through social protection schemes. So there are many ways where social protection can help to bring people into employment. And the third main road is, of course, social rehabilitation, which focusing to ensure that people have the ways to communicate, that there are transport for people who are, for instance, challenges with regards to transportation, for commuting, getting to work and getting back to work, going back to home. When we're looking at challenges to going into the labor market, we should focus already on education and preschool. As it is for every person, having a proper education is key to get into the labor market. And what we see, and not only in developing countries, but in many, many developed countries, is challenges for disabled people with disabilities to have proper pre-education and education, school education. So addressing already this to make sure that people then have the skills to get into employment is key. And this is particularly important in the whole future of work context, where education will play a much bigger role actually than it is even doing today. Having this in mind, you also need to be aware that in many, many countries, there is even not funding for the basic assistance technology, like for instance, wheelchairs, like for instance, prosthetics. More than 90% of the people who are in need don't have access to these kind of support. So it's of crucial importance to make sure that people who need this kind of support, like for instance, wheelchair, like for instance, prosthetic, get this support. And there is an initiative, the Global Partnership for Assistive Technology, who has committed to provide 500 million people until 2030 with this support, and we really need to support it. People with disability is not a homogeneous group. They are very, very diverse, and their needs are very diverse. And when we look at the impact of COVID on the employment of people with disabilities, we see the impact has been very diverse. People who had a problem with mobility impairment benefited very much from telework because they could work from home. They're benefiting also from digitalization. If you have a cognitive challenge, you're a cognitive disabled person, you were very much disadvantaged because you need someone to support you. Most likely you do work which cannot be done by telework, but which you need to do in the factory, where you need to do in the workshop. So we need to really see what has been the impact of COVID on the different groups and then support them accordingly. So for many people, it means have this agile form of work which you have at the moment. And for people who cannot do that, to ensure that there are possibilities for them to get the support at the workplace. I think we have to learn today tremendous examples from Brazil, from Iraq, from Thailand. And it is important to share that more widely, because too often we are in this small community where we share this, but we need to go out. The Argentinian G20 in 2018 had one focus, which was on employment of people with disabilities. Now the Indonesian G20 presidency wants to again to focus on it. And that is actually the best possibility to have broader impact, to go out there and use the G20, the Indonesian G20, to have this exchange of experience, of lessons learned. And finally, employers' organizations can play a key role. They play a key role not only because they are multipliers, so they're supporting companies to adapt their workplaces to hire people with disabilities, but also they are part of policy making. They are often on the board of social protection systems. They are often part of National Economic and Social Council. So really, this is a collective action which is needed, and use Employers Federation to move this agenda forward. Thank you so much.
Excellent, brilliant. Thank you so much, Matthias, for this very rich contribution, taking us through all that social protection systems can do to support medical rehabilitation, occupational rehabilitation, social rehabilitation, Of course, a lot of this is outside the realm of social protection systems narrowly defined, but social protection systems can play a strong role in providing access to these other services that are also needed. Of course, there's a lot, I mean, infrastructure requirements in terms of transportation, communication, but also other services such as education that you rightly mentioned. All of this will contribute to facilitate access to labor markets for people with disabilities. And we've all heard your strong call for going out there and mobilizing. This is important. This concerns all of us. There are people with disabilities across all social groups, across all ages, across all countries, across all sectors. And indeed, we can all do something to contribute to their social and economic inclusion. Thanks a lot. We're already 1 minute over time. There's a really interesting session starting next on disability assessment and determination that we shouldn't miss. So I invite you all to disconnect here and join us in our other session. I believe that maybe socialprotection.org will post the link if you want to get connected to the next session. So stay with us, and thanks a lot for joining this session.